I'm going to keep, in the interest of time, my introduction of Dr. Bala pretty brief. She's, of course, the co-director of our Institute for Implementation Science. Her projects address critical challenges primary care teams and patients face, including integrating behavioral health, enhancing uptake of cardiovascular preventative services, and cancer screening. And we'll get a perspective from the reviewer side and study section now from Dr. Bala. Let you take it over.
Thank you, Stephanie. And we'll try to make this quick if I can. So I'm an implementation scientist and researcher, but I'm also a member of the study section that Gila mentioned, which is SIHH. And so Maria and Amanda asked me to speak from that perspective a little bit. And truly, we're all focused on doing the best science, presenting the best science, but we also need to navigate the funders' sort of maze of how to navigate it. And of course, Gila and Rachel and all our colleagues at the funding agencies are extremely helpful, but I hope that this presentation helps a little bit in terms of navigating it a little bit. Okay. So as I said, I've been a study section member at the Science of Implementation in Health and Healthcare, SIHH, since June 2021, and I review assigned grant applications about 7 to 8 each time, 3 times a year. It's quite a it's quite a huge undertaking. And in the first year, I was sort of like, oh my God, what did I agree to do? But as the years went by and I started doing more of them, it's been really a great experience, learning experience to see a range of them. And I really encourage anyone who's invited to do this to consider it and do it with open eyes. It is a lot of work. I have 8 that are in my inbox or in my queue to review for the June submission deadlines, right? I'm going to be working on that. Before I go in any more detail, in the interest of really maintaining peer review integrity, I checked with Wenjun, whose photograph you saw in Gila's slides, about what I can discuss and what I cannot discuss. I can discuss the peer review process and SIHH in very general terms. What I cannot discuss is any grant applications, even as examples, any conversations and discussions that have occurred at any of the meetings I've attended, things that are specific to any of the meetings, applications, or reviewers. So I just want to put this out there because the questions can very quickly go into how does this work and what did you review and so on and so forth, and I cannot discuss those kinds of questions. So this figure, and a lot of the resources I really have pulled from the NIH Center for Study Section, Center for Scientific Review, sorry, CSR, straight out of the website. But I hope that it's all still beneficial to all of you. And I really encourage you to go to those website links that I've provided when you get the slides. But this is a overall review of the grants process. You kind of get started, you learn the basics, you plan your approach. We're often, as researchers, focused on the application for grant funding. We prepare the application, we write it, and we submit it. But then there is this whole thing that happens afterwards, which is of referral and review. And that's kind of what I'm going to be focusing on today a lot more. So in terms of the receipt and referral, the applications that are, they meet the guidelines and policies are assigned to an institute or center and to a scientific review group. And then a peer review of the application occurs. And then after that, there are other steps around pre-award and award process. So at the time of us submitting an application to NIH, we're encouraged, although not required, to include what is this PHS assignment request form. How many of you know about this? Just quick show of hands. Few. I think this is really important because NIH is saying, well, tell us what you want, where you want your application to be assigned, which institute and which specific study section. And there are even a few other things. You might identify some specific areas of expertise needed to evaluate your application that perhaps is not on the study section. And in that request in this form, PHS assignment form, you can say that I think my application will benefit from having an implementation scientist expertise or from a biostatistical expertise in, cluster randomized trials, some of those things, and that might help the individuals assigning these applications to consider which study section would be appropriate. So what is a study section? And we also call it the scientific review group. Before I go into this, I also want to say, well, I'm not saying any of these things from the NIH as representing NIH views. It's really more from how I have made sense of things over the years. It's also called the scientific review group. And really the study section is the primary audience for your grant application, for our grant applications. And it behooves us to really get to know this well, because we're writing for those set of academic scientists who are reviewing our grant applications. There are actually more than three, but I highlighted three here from the website. The chartered or standing study sections. These review most investigator-initiated research opportunities like the R01s, R03s, R21s that Gila and others were talking about. And these study sections are those with both regular standing study section members like I am, and also ad hoc or temporary members that are brought into the study section as needed. And that's also a way of vetting members, and they'll review for one cycle or two cycles, and if they're really adding a lot of value to the field and to that study section, are often recruited to become standing study section members. Actually, I just realized one of them is right here. And of course, Maria has reviewed, and several of y'all have experience in this. So the other two are special emphasis panel. So some of the grant opportunities Gila brought up that were like U01s, U54s, that have RFAs associated with it. Sometimes we'll have a special emphasis panel that is put together separate from these chartered study sections. So it's only for that grant mechanism. And then there are fellowship study sections. So I really want to emphasize this point of preparing our applications with a careful review of which study section it's going to, who are the members, what is the discipline, the scientific disciplines represented on that study section, what is your science, and how can you kind of anticipate perhaps from based on what you see of that study section to address or emphasize some aspects of it. And in implementation science, I find it really important, for example, to better define and describe all of the jargony things that we've already discussed earlier today. If you find that in your study section, you don't have an implementation scientist. For example, if you want to say something about strategies, define it. If you want to say something about hybrid ones, hybrid twos, hybrid threes, I think it behooves us to define it a little bit more, anticipating someone on the study section who doesn't know it and who may end up saying, well, what is innovative about that? Or why are you doing that? So kind of anticipating that. So how are our applications assigned to study sections? And what CSR tells us is that a representative of the CSR is looking for a fit between the published guidelines and the application. And they're looking at the abstract, the specific aims, the overarching goals, the methods, and the approach. And a review of those together allows them to say, well, this should go to a XYZ study section. And they also consider conflicts of interest between key personnel and the study section members. And to bring it back to that PHS assignment form, the suggestions that us as investigators make on that form also very much help the study section SRO to make those decisions. There are two very good resources on the CSR websites to find a study section. You have this little search box. You put any keyword or title of the study section and it will pop up some suggestions for you. And then there is also this assisted referral tool where you can actually put in an abstract or a title that then makes suggestions for what study sections would be most appropriate for your grant application. So that was sort of overarching, just generally about study sections. SIHH is the study section I'm on. And just a couple of slides to say, well, what applications does SIHH review? What you'll see here is a focus on strategies, implementation strategies, implementation theories, and implementation methods that are designed to integrate evidence-based interventions into public health, clinical, and community settings, both in the US and globally. So these are not just specific to the US context. SIHH reviews applications that have a major methods, strategy, or theoretical development component in implementation science. And the primary objective in SIHH is to assess the impact of a strategy on implementation outcomes like adoption, fidelity, and sustainability. Secondarily, of course, many of these applications also assess the clinical effects, the health outcomes, but a robust focus on implementation outcomes and on implementation strategy is something that SIHH is looking for. So to say SIHH reviews type 3 hybrids in our implementation science jargon. Of course, the type 3 hybrids are focused on implementation outcome and may include analysis of clinical or intervention outcomes. They also review some type 2 hybrids where there is a concurrent focus on both effectiveness and implementation aims. But there is still a very strong emphasis on the comparing of the different implementation strategies. So it really is a study section where we're looking for more of that focus of taking it from just demonstrating effectiveness of a specific intervention to also assessing and comparing strategies. And I would say that the SIHH review section, if you see the composition of it, you'll see a lot of implementation scientists on it. You'll see from the US and other countries, our statistics representation are also people who have experience in implementation science. And it's been a really good study section for review of those grants. So what does SIHH not review? So where the focus of the application is mostly on testing the effectiveness of an intervention with a secondary focus on understanding the context. These are type 1 hybrids. It's still implementation science, but SIHH is not really seeing a lot of these applications. And there are other study sections where those applications may fit better. And these are listed. And I really encourage you all to look at these study sections and where in the implementation, how early or late in implementation your studies might be. So if you're early on, you're still looking at an evidence-based intervention, or you're looking at an intervention that you're somewhat adapting, but it's very much on the effectiveness of the intervention itself. And you have like a process evaluation aim, see if it fits in one of these other study sections. So typical implementation science grants, a little bit of a summary. We're seeing type 2 and type 3 hybrids that also have a very strong focus on an organizational level, not just on the individual level. A lot on clinical and community settings, including global contexts. Often those applications really show a robust understanding and mastery of theories, models, and frameworks. So the presentation before us was really important. Where the applications show a clear distinction of intervention and implementation strategies that you can immediately get a sense. I think many of us have been like, what is the thing and what is the thing that you are going to do to actually implement the thing. There's a focus on mechanisms, as Dr. Lewis's presentation talked about. Very robust mixed methods that focus not just on, that focus more on integration and not just sort of parallel mixed methods. Many cluster randomized trials, very strong focus on implementation outcomes, barriers and facilitators and their assessment. And so Maria's presentation on that is really important, and aligning the strategies to that, incorporating cost and cost effectiveness. These are the kinds of things, and none of these boxes are a grant in itself, but are elements of what might be seen in the grants. And I want to end with a new thing that is coming in for the peer review for applications that are of due dates Jan 25th or later. So we're all very familiar, those who are applying to NIH, of 5 previously used criteria or currently used criteria of significance, investigators, innovation, approach, and environment. That's kind of how we've been doing business and submitting grants for a while. But after January 25th, 2025, these criteria are going to be reorganized into 3 factors, where factor 1 is about the importance of the research and combines significance and innovation, scored on 1 to 9. Factor 2 is on rigor and feasibility, which is sort of the current approach, scored also on 1 to 9. And factor 3 is on expertise and resources, which previously was investigator and environment, which is going to be evaluated as either sufficient for the proposed research or not, and not on that 1 to 9 scale as we previously. I think it's something we need to be paying attention to and thinking about as we write our grant applications. And what these new criteria are really doing is to get us reviewers and researchers submitting grants focus on 3 central questions. How important is the proposed research? How rigorous and feasible are the methods? And whether the investigators and institutions have the expertise, resources necessary to carry out the project. And of course, that's what we've been doing all this time, but I think it's making it more explicit. Like in our review panels, we all ask the question, should this research be done? And can this team do it well? And if we can answer those questions, it really helps to evaluate the application better. So in summary, really focus on targeting your application. Use the NIH reporter to locate funded applications in your field so you get a better sense of where they might have been reviewed. Use that tool, the assisted referral tool, to really find the study section that aligns with what you're proposing. Use that assignment request form in your application. I really encourage you. And then the 4th thing is pay attention to the new peer review criteria that are coming down the pike. I'm not an expert in NIH study sections, just someone who has a bit of experience. And all our NIH program officers and SROs are friends and a resource we should be leveraging a lot. I have learned a lot from interacting with them, networking with them over the years, and I think that we should do that. Thank you.